Hello, the spring is coming and the kids are ready to get off for spring break. It's a really good time, and you know what I decided to do is a really good, exciting video that something everybody's going to be helpful. Not only the kids, adults, patients of all ages. I'm going to talk about brushing technique. Okay, so there is in our dental journals there are a lot of articles about what is the correct kind of brushing, what is not the correct kind of brushing. And there's a lot of different correct kind of brushing. I'm gonna talk about brushing technique that I use, that I prefer. So now before I jump into the brushing technique, let me tell you, we need to know what are the surfaces of the teeth that we're trying to clean. Now each tooth has 5 surfaces that needs cleaning: the buccal, or towards the cheek or the lip; lingual, or towards the tongue of your mouth, towards the tongue in your mouth; chewing surface; and 2 proximal surface. Proximal surface are in between the teeth. Okay, so these are the 5 surfaces we need to clean. Now, using toothbrush, we can only clean buccal, lingual, and the chewing surface. We cannot clean the proximal surface, so we need flossing to clean the proximal surface. Okay, so I'll cover that as well. Alright, so let's get started with the brushing. For our upper teeth, that's the ginormous teeth here, and ginormous toothbrush. So what we do here is always point your toothbrush towards the gum. So point the bristles of your toothbrush towards the gum and give a stroke downwards. Okay. So for the buccal surface, we give 10 strokes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, depending on the size of your toothbrush head, that will clean at least 3 teeth or so. And then you move on. Do same thing for 10 strokes again. Keep on doing until you're all done with the buccal or outer surface. Then you do the inside surface, and exactly the same thing. Bristles go towards the gum of your teeth, and then bring the stroke down. So this is what you're not doing. You're not going back and forth like this. Okay, you are going from top to bottom. Okay, so bristles towards the gum and go down. So on the upper teeth, you're going top to bottom. Same thing for outside, same thing for inside. Now on the chewing surface, you can pretty much go back and forth like this. Okay, now that's how you do the upper. Now for the bottom, it's pretty much similar. You have to remember, always point your bristles towards the gum, and then so down here you move your toothbrush up. Give a stroke from bottom to the top. Right? So on the upper teeth, top to bottom. On the bottom teeth, bottom to top. Remember, you're aiming the bristles towards the gum, basically taking stuff out that is stuck underneath the gums. So the same thing, give 10 strokes for each tooth and move around all the way, then go to the inside. Now this is sometimes, if you're trying it for the first time, it's going to be a little bit tricky, but pretty soon you'll get used to it. This whole process should not take more than 2 minutes. Okay, so that's what we had talked about, the brushing. Now going to flossing. Now if you're only brushing and not flossing, you're only cleaning 66% of the tooth. You're not cleaning the between portion of the teeth. Okay, now take about 12 to 15 inches long floss, approximately this. You pretty much know, wrap it around your finger like this. Now the key thing that I want you to understand in the flossing is, I know everybody knows going between between the teeth from top to bottom, but what we want you to do is, instead of just going top to bottom, try to hug the tooth with the floss. Okay, so try to hug the tooth with the floss and then bring it down and then take it out. Okay, so you're hugging the floss. So it's not just top and bottom, you're hugging the surface of the tooth and then going bottom to the top. Okay, so that's about flossing. Third thing is using the mouthwash. It is not mandatory to use the mouthwash. You can use the mouthwash. If you're in a rush, you really want to get a quick, nice breath, you can use the mouthwash. But mouthwash is not necessary. This is what I tell to all my patients. After any kind of meal, after you eat anything, make sure you rinse your mouth with water. So rinsing your mouth with water is critical. Okay. So we covered brushing, flossing, rinsing, and the fourth thing is scraping of your tongue. Now this is something that not a lot of people are familiar with, but you need to scrape your tongue. The bad breath causing bacteria lie on the top of the tongue. So after brushing, flossing, rinsing, you need to scrape your tongue. And this is a tongue scraper. You basically put it on your tongue and scrape it gently. Make sure you don't do it too hard, otherwise it's gonna go ahead and hurt your tongue. Okay, this you can buy it at any store. It's called tongue scraper or tongue cleaner. So we covered brushing, flossing, using your mouthwash or water, scraping. The last thing I want to say is, if you use electric toothbrush, you can use electric toothbrush. They are very effective. However, what I noticed is, number one, they're expensive and you still have to use pretty much the similar technique. So if this is electric toothbrush, you still have to put it the same way, bristles towards the gum, and gently bring it down. Okay? So that's with the electric toothbrush. You can use whatever you want, a Sonicare, Oral-B powered brush, or whatever works for you. Okay? I don't have any other preference. I hope this video was interesting and informative. Again, I want to, if you have any questions, please feel free to give us a call. Our phone number here is 916-782-3129. And again, I want to thank you and your family very much for trusting us and trusting us to bring your family over here for your dental care. Thank you so much.